Dr. Mansoor Madani, Chairman, Department of Oral and Maxillofacial Surgery at Capital Health System in Trenton, New Jersey, and Associate Professor of Oral and Maxillofacial Surgery at Temple University, Philadelphia, Pennsylvania. Welcome back. If you have not heard me before, please check my previous videos titled Pain Management. I covered various descriptions of pain, differentiation, classification, and treatment. I described the differences between acute and chronic pain and how to appropriately assess anticipated pain and recommend appropriate treatment for a patient's pain, and recommend a treatment regimen based on what type of pain, severity, and patient-specific characteristics. I also described the differences between analgesic and co-analgesic or adjuvant drug classes. I explored ways to recognize inappropriate pain management regimens and how you would be able to recognize opioid-related adverse effects, addiction, and ways to prevent addictions. One focus of my previous presentations was to explore history of drug discoveries. It is fascinating, thought-provoking, and educational, a tale of humans' most challenging crusade to find a cure for chronic pain. If you have not listened to those presentations, please do so. And a note before I start my presentation, if you like to receive more information or a CE credit, please visit us at www.snorenet.com, register at our website at www.balasurgery.com, that's BALA surgery.com, and I look forward to see you more. So make sure to subscribe to our website and YouTube channel to receive more information. Now let's begin our presentation. It has been said that those who do not learn from history are doomed to repeat it. In other words, those who do not remember their past or who fail to learn from the mistakes of their predecessors are destined to repeat their mistakes. Many medications were thought to do wonders in the past and labeled as safe and harmless have failed or proved addictive. Many new ones were also marketed strongly but falsely, leading to abuse and devastation and the loss of hundreds of thousands of lives. Opium as well as marijuana are regarded as likely the first narcotics and hypnotic substances discovered at the dawn of humankind. The history of drug addiction is immensely rich and allows for tracing the long way humankind had to travel to reach our contemporary knowledge with respect to narcotic substances and other substances such as marijuana. A retrospective view of drug addiction that takes into consideration the historic context while extending our knowledge also allows for a better understanding of today's problem. That's why I do recommend to listen to my lecture on history of drug discoveries, what William Osler calls opium as a God's own medicine. As I explored in that detailed presentation, opium got millions addicted. Then opium pills were created in 1527 to control the addiction of opium smoking and eating. In 1530, laudanum, diluted opium and alcohol, 40% opium and 60% alcohol, was introduced to reduce addiction, to prevent opium addiction. Then morphine was introduced in 1806, followed by codeine in 1832. In 1859, cocaine was introduced as a safe drug. All of these drugs started out as legal safe substances and considered at first to be cure for many diseases, miracles, but then they started to be abused and addiction started. Cocaine in recent years have been smuggled in various and ingenious ways and got millions of people addicted, and that's what we discussed in the past presentation. As I said, all of these drugs started out as legal and safe substances, considered at first to be cure of many diseases, and actually they called them miracles. Opium, morphine, cocaine, codeine, heroin, LSD, amphetamine, ecstasy, and marijuana. Many sat on the shelves for years before becoming abused. A mixture of rumors, myth, and science have contributed to changes in legal status of these drugs. Now we have a new miracle drug. The current potential miracle drug is marijuana. Marijuana is now being hailed as an exit drug from alcohol and prescription abuse and narcotic addiction to manage pain, PTSD, and many more. Marijuana use may have a wide range of health benefit on the body and brain, as they claim. So it is in this section I want to review what we know today about marijuana, cannabis, and hemp. So you may ask, why do I have to know about marijuana? It may apply to someone that you treat, like your patients. You may know, maybe a family member or a friend that you care for. Marijuana is the most commonly used illegal drug in the United States, with 37.6 million users in 2019. Based on a report by National Institute of Drug Abuse, or NIH, in 2019, 11.8% of 8th grade students reported marijuana use in the past year, with 6.6% in the past month. Among the 10th graders, 28% had used marijuana in the past year and 18.4% in the past month. Rate of use among 12th graders were even higher. 35.7% had used marijuana during the year prior to the survey, and 22.3% used it in the past month. 6.4% said they used marijuana daily or near daily. With the growing popularity of vaping devices, teens have started vaping THC, the ingredient in the marijuana that produces the high, with nearly 4% of the 12th grader saying they vape THC daily. So let's explore marijuana. Marijuana history. Cannabis is indigenous to Central Asia and Indian subcontinent. Hemp is possibly one of the earliest plants to be cultivated. Cannabis, as well as hemp, has been cultivated in China and Japan since the pre-Neolithic period, about 8 to 10,000 BC, for the fiber and as a food source, and possibly as a psychoactive material. Chinese Emperor Shen Nong in 2700 BC used it as a medicine. They used hemp fiber to make clothes, shoes, rope, and an early form of paper. In the 3rd century, Romans used hemp to make rope and sails. Cannabis was utilized in Africa 6 centuries ago for religious, social ritual, medicinal purposes. First, let's look at the word cannabis. The word cannabis saw its first origin in the Neo-Assyrian or Neo-Babylonian word canub or kanubu, a word meaning a way to produce smoke, suggesting its use for recreational substances. Ancient Semitic group trading with these culture began referring to the planet as Kanubusem. Separately, Kanubu would be adopted by the Sekaha of the modern-day Eastern Iran, eventually evolving into the Persian Kaneb and Greek cannabis or cannabis. Cannabis would become its Latin counterpart, which has remained to this date. The word marijuana, also spelled marijuana, originated from ancient China, based on some of the report. Some of the first cultures of or cultivation of cannabis, who referred to the plant of marehao in Chinese, or hemp seed flower. Some other authors believe that the term marijuana comes from the Spanish or Portuguese word meaning intoxicant. The chemical substance largely responsible for the hallucinogenic property is known as trans-delta 9-tetrahydrocannabinol, or THC. CBD, or cannabidiol, is a cannabis compound that has multiple use and benefits. Now let's look at the botany, or the scientific look at the plant, including the physiology, structure, genetics, ecology, distribution, classification, and economic importance. The difference between marijuana, cannabis, and hemp should be clarified. Cannabis is the genus of the plant, so all the hemp and marijuana varieties are a type of cannabis. When we look at a species or genome of cannabis, there are two that are important to know: Cannabis sativa and Cannabis indica. Cannabis sativa is an annual herbaceous flowering plant indigenous to Eastern Asia, but now of cosmopolitan distribution due to widespread cultivation. Each part of the plant is harvested differently, depending on the purpose of its use. The species was first classified by Carl Lennox in 1753. The word sativa means things that are cultivated. Cannabis sativa are most common. They have high concentration of fiber and are still used for hemp. Typical plant produces 1 to 5 pounds of bud and smokable leaves. Although the main psychoactive constituent of cannabis is tetrahydrocannabinol, or THC, the plant is known to contain more than 500 compounds, among them at least 113 cannabinoids. However, most of these minor cannabinoids are only produced in trace amount. Besides THC and other cannabinoids produced in high concentration by some plant is cannabidiol, or CBD, which is not psychoactive but has recently been shown to block the effect of THC in nervous system and some other medicinal benefit which we are going to talk about. Differences in the chemical composition of cannabis varieties may produce different effect in human. Cannabis indica is an annual, shorter and bushier plant, stronger, smellier than Cannabis sativa. They call that skunk weed. Whether it and Cannabis sativa are truly separate species is a matter of debate. The Cannabis indica plant is cultivated for many purposes. For example, the plant fibers can be converted into clothes. Cannabis indica produces large amount of THC. The higher concentration of THC provides euphoric and intoxicant effect that we are going to talk about that in just a moment. Now let's look at the differences between hemp and marijuana. Although both plants are part of the same species, Cannabis sativa, they have major differences. Hemp is reserved solely for cannabis plants containing little to no THC, usually less than 0.3%, meaning that smoking hemp will not ever get anyone high. Hemp plants are a heavily selective bred variety of Cannabis sativa species and have more industrial purposes, such as use in creating ropes, biofuel, clothing, and much more. Hemp is grown in over 30 different countries. Hemp can be grown in a wide range of areas. It contains minimal THC, as I said, between 0.05 to 1%, but it contains more CBD than average cannabis plant. Hemp oil, for example, contains 18 to 27% CBD, but less than 0.3% THC. As I said before, marijuana is the term used to describe the psychoactive variety of cannabis. which include Cannabis sativa and Cannabis indica species, and contain a fair amount of THC and CBD. Marijuana plant barely exceed 5 feet in length, grows with more leaves and bud, and can be grown in generally warm and humid environment. Its flowers contain an average of 10 to 14% THC. Marijuana oil, for example, has 10 to 15% CBD, but has a much higher THC, about 50 to 60% THC. Hemp trees can grow up to 4 meters or 15 feet tall, which a marijuana plant could never reach. To recap then, cannabis is the overall species. Hemp is generally used for industrial purposes, and marijuana is used for recreational purposes, and CBD is used for medicinal purposes. The THC content of cannabis varies in different parts of the plant, generally decreasing in the following sequence: resin, flowers, leaves, with little THC in the stem, roots, and seeds. Hemp seeds are high in complete protein and a great source of iron. They can be eaten raw, ground into hemp meal, made into dried sprout powder. Hemp seeds can also be made into a liquid and used for baking or for beverages such as hemp milk. Hemp oil is cold preserved from the seed and is high in unsaturated fatty acid. The leaves of the hemp plant, while not as nutritional as the seeds, are edible and can be consumed as a leafy vegetable in salad and preserved to make juice. So hemp seed could be used in confection, beer, flour, feed, dietary fiber, snack and non-dairy milk, baking additive, and hemp oil could be used as cooking additive, salad dressing, dietary supplement, body care products, fuels, detergent, spreads, and paint. The hemp fiber could be used to make fabrics, insulation, carpeting, paneling, pulp and paper, recycling additive, automotive part, and animal bedding and mulch. How about a car made entirely out of hemp? This was an idea that has been around for a long time. In the 1940s, Henry Ford spent many years researching a car made from hemp that would run on hemp biofuel. Sadly, hemp production was declared illegal. Some say that this is due to the link between hemp and marijuana, while others claim that big companies at the time pressed the US government to declare the material illegal, as hemp production was a powerful threat to their paper production and other businesses. While the Kestrel, a Canadian eco-friendly hemp car, still isn't ready for production, it is attracting a lot of attention from global investors and countries. The lightweight, durable material means fuel efficiency and environmentally safer too. When we talk about the pharmacology of marijuana, there are between 420 and some people they say 500 compounds, among them at least 113 cannabinoids. And then there are some other researchers, they say between 30 to 60 cannabinoids. But the most potent one is the THC. Ingested orally causes intoxication within 30 minutes. When marijuana is smoked, THC and other chemicals in the plant pass through the lung into the bloodstream, which rapidly carries them throughout the body to the brain. The person begins to experience effect almost immediately. 59% of a smoked THC absorbed versus 3% of THC when orally ingested. Many people experience a pleasant euphoria and some sense of relaxation. Other common effects, which may vary dramatically among different people include heightened sensory perception of such as brighter colors, laughter, altered perception of time, and increased appetite. If marijuana is consumed in food or beverages, these effects are somewhat delayed, usually appearing after 30 minutes to an hour, because the drug must first pass through the digestive system. Eating or drinking marijuana delivers significantly less THC into the bloodstream than smoking an equivalent amount of plants. Because of the delayed effect, people may inadvertently consume more THC than they intend to. When THC is smoked, the effect could last between 3 to 4 hours and even longer if ingested orally. I have to add that the pleasant experience with marijuana are by no means universal. Instead of relaxation and euphoria, some people experience anxiety, fear, distrust, or panic. These effects are more common when a person takes too much, the marijuana has an unexpectedly high potency, or the person is inexperienced. And people who have taken large doses of marijuana may experience an acute psychosis, which include hallucination, delusion, and loss of sense of personal identity. These unpleasant but temporary reactions are distinct from longer-lasting psychotic disorders, such as schizophrenia, but may be associated with the use of marijuana in vulnerable individuals. Although detectable amount of THC may remain in the body for days or even weeks after use, the noticeable effect of the smoked marijuana generally lasts between 1 to 3 hours, and those of marijuana consumed in food or drink may last for many hours afterward. In 1960, so-called joint had 1.3% THC. Currently, much more potent concentration ranging from 4 to 15% concentration of THC is present in the joint. So one joint today is equivalent to smoking 3 to 5 joints in 1960s. When we look at the pharmacology of marijuana, marijuana is a fat-soluble chemical. Effects may persist or reoccur for 12 to 24 hours. The ability to drive a car or plane or other motor performance task will be affected. Alertness and ability to concentrate may be affected for hours to days after use of marijuana. Now let's look at the pharmacology and specifically mechanism of action of marijuana. In 1990, at Johns Hopkins University, receptor sites in the brain that were specifically reactive to the THC in marijuana were discovered. In 1992, NIDA, or National Institute of Drug Abuse, announced the discovery of anandamide, which is a Sanskrit word for bliss, the natural neurotransmitter that attaches into the receptor site. The receptors for anandamide found in several regions of the brain, but not that much in the brainstem as compared to receptors for opioids and cocaine, for example, and that's why it is so difficult to physically overdose with marijuana. In this simple illustration, I have tried to show the similarity of the natural brain's neurotransmitters, anandamide, as compared to the THC neurotransmitters. Like other psychoactive drugs, THC activates neurons because its chemical structure mimics the natural neurotransmitters. Because of that similarity, THC can directly and indirectly target the brain's reward system by flooding the circuit with dopamine. Please see my detailed explanation of the neurotransmitters in the part 2 of the pain management presentation I have online. But in short, dopamine and serotonin pathways are two brain systems affected by drugs of abuse. By altering activities in these pathways, abused substances can influence their function. Dopamine neurons, thereby influencing pleasure, motivation and motor function. Another neurotransmitter, serotonin, which is also affected, plays a role in learning, memory, sleep, and mood. When we look at the epidemiology of marijuana use, according to the United Nations, 158.8 million people around the world use marijuana. That's more than 3.8% of the planet's entire population. In the United States, in a July 2019 Gallup poll, it showed that 12% of the US adults said they smoked marijuana, a percentage that is essentially unchanged since 2015. Men, 15%, are more likely to smoke marijuana than women at 9%. Look at this chart. Shows an increasing use of marijuana in 2016, then steadily until 2019. It is anticipated that this curve will show a significant increase in 2020 and beyond because of the current pandemic. Based on the same study by Gallup, at 22%, 18 to 29-year-old are the most likely age group to smoke marijuana, about twice as likely as those between ages of 30 to 64, and 7 times as likely as the older than 65 years old. Between 13 to 16% of adults across the East, Midwest, and West smoke marijuana versus 7% in South. And most importantly, of the adult 26 or older who used marijuana before age 15, 62% went on to use cocaine at some point in their life, 9% went on to use heroin at least once, and 54% made some non-medical use of mind-altering prescription drug. This is an important point when we speak of drug addiction and substance use and abuse. Hence, marijuana is considered by some scientists to be a gateway to drug addiction. Next to alcohol, marijuana is the second most frequently found substance in the bodies of drivers involved in fatal automotive accident. Here are some sad statistics based on research from the National Institute of Health in 2019. 11.8% of the 8th graders, they use marijuana. 28.8% of the 10th grader and 35.7% of 12th grader used marijuana. 6.4% said that they used marijuana daily or near daily. 4% of the 12th graders saying that they vape THC on a daily basis as well. Now, let's compare the prescription and over-the-counter drugs versus illicit drugs, such as marijuana and other illicit drugs. The percentage of 12th grader who have used drugs in the past year, this chart is interesting to look at. Percentage of use of marijuana at 36.4% versus all other drugs, and all of the illicit drugs are in blue, and the over-the-counter or prescription medication are in red. And you see that marijuana has the highest percentage, even more than Adderall or Vicodin, which are just next in line. Next is to look at the physical impact of marijuana. Let's look at that. What's the impact of it on our body? First is the physical impact. The impact depends on many factors and is different for each person. It depends on the amount of the THC in marijuana, for example, the potency or strength, how often an individual uses it, at what age they started to use it, and for how long. And most importantly, if any other substances used at the same time, substances such as alcohol, tobacco, opioids, and etc. Now let's look at the short-term physical effect. They include relaxation to sedation, conjunctival ecchymosis due to increased blood flow through the mucous membrane of the eyes, coughing, lung irritation, some pain control, increased in appetite, loss of musculoskeletal coordination. decreased blood pressure but increased heart rate, decreased ocular pressure, decreased nausea, impaired tracking ability. Marijuana can act as a stimulant or depressant and causes temporary disruption of the secretion of testosterone. How about mental effect? We have to remember the mental effect depends on setting, and experience. So in short, with mild to moderate use of marijuana, the mental effect include confusion and feeling of separation from the environment, feeling of deja vu, drowsiness, feeling of detachment and being indifferent, difficulty in concentrating. This marijuana use can disrupt short-term memory. But in heavier or stronger use, marijuana has a stimulating effect. Users may feel lightheaded, also could have feeling of distortions of colors, time and sound. With very heavy or a strong dose, user could have a feeling of movement, visual hallucination and hallucination, can exaggerate mood, personality, empathy or suggestibility. Potential adverse psychiatric reaction include hallucination, and especially precipitated individuals who are predisposed with paranoid ideation, which is a mental disorder characterized by disconnection from reality, suspiciousness, or frank delusions are amongst other adverse psychiatric reactions. How about the medicinal use of marijuana? Of course, it could be helpful for some medical problem, but internet is filled with many promises of cure and health benefit of marijuana. They include, amongst many others, treating migraine, preventing Alzheimer, and they claim that it slows tumor growth, which American Cancer Society believes there is no 100% proof of that. They also say that it relieves symptoms of chronic diseases, treat glaucoma. Again, American Academy of Ophthalmology's position is that marijuana is not proven treatment of glaucoma. Prevent seizure. This is true because in certain cases of seizure, marijuana is an anti-spasmodic. It has anti-spasmodic effect, and in fact has been approved for certain types of seizure, which I'm going to talk about it in just a second. It helps with ADHD and ADD, and they claim that it calms patients suffering from Tourette syndrome, helps with symptoms of postmenopausal syndrome. Many of these claims are anecdotal and needs research by scientists to prove their accuracy. When we talk about research, there's one problem. Remember this slide from the previous lectures that I gave? The reason for that is the fact that marijuana is classified as a Schedule I substances, which are drugs or substances that have potential to create severe psychological and or physical dependence. They have high abuse potential, and basically scheduled drugs, they have no medicinal use. An example of scheduled drugs, Schedule I substances were heroin, LSD, and marijuana. So how can they prove these claims? By doing more research. But DEA and CDC need to change the classification of marijuana-based product from a Schedule I status to improve access for a study of marijuana and cannabinoids under Institutional Review Board or IRB approved research protocol in United States research facilities. On June 25, 2018, FDA approved Epidemiology CBD oral suspension for the treatment of seizures associated with two rare and severe forms of epilepsy. One of those conditions that CBD was approved was Lennox-Gastaut syndrome, or LGS, which is a severe form of epilepsy that typically becomes apparent during infancy or early childhood. Affected children experience several different types of seizure, most commonly atonic seizure, which is a temporary loss of muscle tone and consciousness, tonic seizure, which is stiffness of the body, and even atypical absence seizures. The second condition was Dravet syndrome, previously known as severe myoclonic epilepsy of infancy, or SMEI, which is an autosomal dominant genetic disorder which causes a catastrophic form of epilepsy with prolonged seizures that are often triggered by hot temperature or fever. It is very difficult to treat with anticonvulsant medication. It often begins before 1 year of age. The second syndrome was Dravet syndrome, previously known as severe myoclonic epilepsy of infancy, which is an autosomal dominant genetic disorder which causes a catastrophic form of epilepsy with prolonged seizures that are often triggered by hot temperature or fever. It is very difficult to treat with anticonvulsant medication, and it often begins before 1 year of age. CBD was approved, as I said, in the United States for treatment of Dravet syndrome in 2018, and it reduces the amount of seizures from 12 to 6 with the use of CBD, compared with a decrease from 15 to 4 with placebo, based on a research done in 2017. What else needs to be done? Currently, most major American medical organizations, including American Medical Association, American Cancer Society, American Academy of Ophthalmology, and many more, make a statement like this: we do not advocate for the legalization of marijuana-based product for use in treatment of various disorders, as further research is needed to determine the benefit and safety of such products. So basically they are saying that there is much more research needed to be done. CDC statements are as follows. We have a strong evidence that marijuana use may lead to addiction, breathing problem including inflammation of the airway, and symptoms of chronic bronchitis such as daily cough and phlegm, short-term decline in memory, attention, and learning. Also, increased risk of poisoning among children, increased risk of low birth weight in babies when a mother uses marijuana during her pregnancy, and increased risk for psychosis or schizophrenia. Then they say that there are some evidence that marijuana use may lead to increased risk of some type of cancers, increased risk for heart attack and stroke, decreased IQ, and this change in IQ can last a long time and may even be permanent, less academic and career success, lower income, poor school performance, and increased risk for motor vehicle crashes. We already know that hashish, which is a THC-rich resin, has severe drug dependence, and addiction is well documented nationally and internationally. The joint position between FDA and NIH, or National Institute of Health, is that they have not found that marijuana is safe or effective for treating any health problem. States have legalized medical marijuana because of decision made by voters or legislators, not because of scientific evidence of its benefit and risk. This is important to understand, that's why they legalized medical marijuana. At the timing of recording of this video, currently there are 33 legal medical marijuana states and DC, and 11 legal recreational marijuana states and DC. It is believed that 10 additional states may also legalize marijuana after the election of 2020. If you have not listened to my presentation on history of discovery of opioid, I encourage you to listen to that. in a part of that presentation, I found out that in 1849, there was a syrup advocated by the scientists of that time as a safe and effective drug for children. The pharmacist would sell morphine over the counter, but soon they discovered that the addictive nature of morphine, and then after that they discovered another drug which also was hailed as a safe drug. That drug was cocaine. They claimed it is so safe babies could even use it for toothache. Cocaine and was sold in candy jar for sore throat. Then in 1889, another miracle drug replaced cocaine. It was heroin. In fact, Bayer Pharmaceutical was offering free sample of heroin for cough. Now they sell cannabis and marijuana in variety of shape and a lot more attractive to children as well. And the same concept is continuing at present time. So we have to watch out. What is the problem that we anticipate with these edible substances? One of them is poisoning. Edibles or food and drink products infused with marijuana and eaten have some different risk than smoking marijuana, including a greater risk of poisoning. Unlike smoked marijuana, edibles can take from 30 minutes to 2 hours to take effect. So some people eat too many of them, which can lead to poisoning and or serious injury. Edibles can cause effects that last longer than expected depending on the amount, the last food eaten, and medications and alcohol use at the same time. Edibles can be very difficult to measure. The amount of THC is very difficult to measure and is often unknown in edible products. Many users can be caught off guard by the strength and long-lasting effect of edibles. It is also important to remember that marijuana affects children differently than adults. Since marijuana has become legal in some states, children have accidentally eaten marijuana products that look like candy and treats, which made them sick enough to need to go to emergency room and requiring medical care. Now, let's look at the CDC, how they describe the effect of marijuana. First, THC effect in brain, shown here in this picture in yellow. Marijuana use directly affect the brain, specifically the part of the brain responsible for memory, learning, attention, decision-making, coordination, emotion, and reaction time. The higher the THC content, the stronger the effect on the brain. In addition, some methods of using marijuana, for example, dabbing or edibles, may deliver very high level of THC to the user's brain. So let's look at marijuana's short-term effect on brain based on CDC. Heavy user of marijuana can have short-term problem with attention, memory, learning, which can affect relationship and mood. The impact depends on age of first use and potency or amount of the THC. Developing brain, like those in babies, children, and teenagers, are especially susceptible to the harmful effect of marijuana. Although scientists are still learning about these effects of marijuana on the developing brain, studies show that marijuana use by mothers during pregnancy may be linked to problems with attention, memory, and problem-solving skill and behaviors in the children. How about the marijuana effect on adolescents and young adults? Studies have shown that if an adolescent uses cannabis before the age of 16 and for a prolonged period, it can lead to a number of significant health problems. teen cannabis users are more likely to become addicted to cannabis than people who start using the drug when they are much older. Cannabis use can negatively affect adolescents and young adult health and well-being, including their school performance, educational level, social lives, and further employment and income. Can marijuana cure cancer? Based on CDC, the answer is absolutely no. It does not cure cancer. Researchers have found limited evidence of an association between current, frequent, or chronic marijuana smoking and testicular cancer. Because marijuana plants come in different strains with different level of active chemicals, it can make each user's experience very hard to predict. More research is needed to understand the full impact of marijuana use on cancer. At this time, there is not enough evidence to recommend that patients inhaled or ingested marijuana as a treatment for cancer-related symptoms or side effect of cancer therapy. It has been proven to control nausea and vomiting of patients receiving chemotherapy, and it can control neuropathic pain in cancer patients. So, what is CDC's stand on marijuana and heart health? It increases heart rate, so we have to be very cautious when we use local anesthetic or IV sedation and general anesthesia for patients taking marijuana. Temporarily weakens heart muscle contraction, reduces blood flow to the heart, can cause atrial fibrillation. It may be harmful for patients with heart disease, may increase risk of heart attack and stroke. Marijuana and respiratory system. Greater risk of bronchitis, cough, and phlegm production, but symptoms improve once smokers quit. Smoked cannabis has many of the same irritant and cancer-causing substances as smoking tobacco. Marijuana has higher concentration of some carcinogen as compared with cigarette smoking. So let's look at CDC's position on lung cancer. Regardless of the THC content, the amount of tar inhaled and carbon monoxide absorbed are 3 to 5 times greater than tobacco smokers. It may be due to inhaling more deeply and breath holding. More research is needed to know if smoking cannabis increases a person's risk for lung cancer as well. However, it is difficult to determine whether there is a link because cannabis use often overlaps other behavior related to lung cancer, such as tobacco use. One point that we have to remember, patients should be advised that relying on marijuana alone as treatment or for managing side effects while avoiding or delaying conventional medical care for cancer may have serious health consequences. How about psychological effect of marijuana, as I mentioned before, but based on CDC? When used for a long period of time, it has been linked to increased risk of psychosis, delusion, schizophrenia, hallucination, paranoia, depression, and anxiety. Using marijuana during pregnancy may increase the baby's risk for developmental problems, including lower birth weight in babies. More research is needed to know how cannabis use during pregnancy affect babies and their future health outcomes. What we know for sure is that the chemical found in all forms of cannabis, including edible such as cookies and gummies, may be bad for babies. THC can pass to a baby through a mother's breast milk. However, data on the effect of cannabis exposure to the infant through breastfeeding are limited and conflicting. To limit potential risk to the babies, breastfeeding mothers should reduce or avoid marijuana use based on CDC's recommendation. Of course, there are many other side effects, including dry mouth, dry red eyes, dilated pupil, hypotension, vasodilation, increased hunger, sleepiness and lethargy, being tired, a slow reaction time, twice more possibility of getting into an accident, distorted sense of time, dizziness, shallow breathing, and so on. Obviously, when marijuana is used in long term, there is physical dependence. About 10% of patients, they depend on it. Physical withdrawal symptoms will include craving, irritability, sleeplessness, and loss of appetite. I have heard this myth from so many patients and friends that they say marijuana is not addictive. This is definitely a myth. Repeated marijuana use can lead to addiction, which means that the people have difficulty controlling their drug use and often cannot stop even though they want to. And even though it undermines many aspects of their life, they continue to use that. So this is an important point to teach our children, friends, and family. About 1 in 10 marijuana users will become addicted. For people who begin using before the age of 18, that number rises to 1 out of 6 people. Some of the signs that someone might be addicted include unsuccessful effort to quit using marijuana, giving up important activities with friends and family in favor of using marijuana, using marijuana even when it is known that it causes problem fulfilling everyday job at home, school, or at work. Medical marijuana use is approved in Pennsylvania and New Jersey to assist patients suffering from certain serious medical conditions by alleviating pain and improving their quality of life. In Pennsylvania, there's an act or a law that allows patients with serious medical condition to apply and receive medical marijuana. They include lateral sclerosis, autism, cancer, Crohn's disease, damage to the nervous tissue of the spinal cord with objective neurological indication of intractable spasticity, epilepsy, glaucoma, HIV and AIDS, Huntington's disease, IBD, intractable seizure, multiple sclerosis, Parkinson's disease, post-traumatic stress disorder, severe chronic and intractable pain of neuropathic origin, or severe chronic or intractable pain in which conventional therapeutic intervention and opioid therapy is contraindicated or ineffective, and also sickle cell anemia are amongst the list of medical conditions under that act that they are eligible for receiving medical marijuana. So what are the steps based on the Commonwealth of Pennsylvania to get a medical marijuana? First, a patient that has one of those conditions as listed before, they are registered for medical marijuana program at medicalmarijuana.pa.gov. Then obtain a physician's certificate that you suffer from one of those 17 serious medical conditions that I mentioned before. Then they complete registration by paying for a medical marijuana ID card and visit a dispensary in Pennsylvania to obtain medical marijuana. To get medical marijuana, patients, they have to go to this website and click on either of these signs. First, they can click on the left side where there is the shape of a heart, and they can learn about the 17 serious medical condition defined by Medical Marijuana Act. By clicking the button with the suitcase, they can learn how to get medical marijuana, and the next one is get a safe harbor letter for minors suffering from one of the 17 serious medical conditions. On the stethoscope, they can press on it and find a physician that can write a prescription for that. Then on the bottom left hand side, apply for a medical marijuana ID, and next one is find the dispensary, complete the practitioner registration. For physician, they should go to that line and complete that registration. And of course, at the far bottom right side is read the latest news from the medical marijuana program. There are several cannabis medications that are approved for use in medicine. One of them is sativa. Sativa is the only drug approved for MS treatment in several countries, including Canada and United States. The drug was approved by the US Food and Drug Administration in 2018. Side effect of sativa includes dry mouth, dizziness, drowsiness, fatigue, and other issues related to one's memory and digestion. And as I said, it's used for MS and treating pain in patients with advanced cancer. The last line in that slide is wrong. It is approved by FDA in United States. The next drugs are Medicinal and Sesamet. They are approved by FDA to treat nausea and vomiting caused by cancer chemotherapy, also approved for weight loss and poor appetite in patients with AIDS. Finally, as I mentioned earlier, Epidemiology is a Schedule 5 drug which was approved by FDA as an oral suspension for treatment of seizure associated with those two rare and severe forms of epilepsy, as I explained before, Lennox-Gastaut syndrome and Dravet syndrome in patients 2 or older. But look at the price of this medication online, and you see that the annual price for use of this medication is $32,500 per year. That's how much it costs to use that medication. Finally, even though pain management is one of the most common reasons people use medical marijuana in the United States, there is limited evidence that marijuana works to treat most types of chronic pain. And remember what I said earlier in the other presentation, the opioid epidemics of then and now are similar in many ways, but there is one great difference. Doctors and opioid addicts in the 1800s could plead ignorance of the danger within these substances. We don't have that excuse today. We now know the benefits, harm, effects, side effects of opioid as well as marijuana, but yet continue to either prescribe them in some cases without merit, or in cases of marijuana, approve them for use without certain scientific protocols. So addiction is a developmental disease. It starts early. Marijuana could be a gateway to start using other medications. Thank you for your time, and I hope that you have enjoyed this presentation, and I look forward to see you in the next presentation. Have a great day.